Can you tell me about what you learned in this study and what this study concluded?
Yes. So this was the work of my friend and colleague, Dr. Albert Denas. He's a psychiatrist who's been practicing in Toulouse, France for more than 35 years. So after witnessing a young family member, someone in his extended family with autism and seizures improve within weeks of adopting a ketogenic diet, he thought, well, I wonder if this diet could help my patients, especially my patients who are not responding to anything else that I have tried to help them: psychotherapy, medications, hospitalization. And so he invited 31 of his most treatment resistant patients with bipolar disorder, major depression, or schizophrenia to come into the hospital and voluntarily try a very mildly ketogenic whole foods diet in the hospital under his supervision to see whether or not they would respond. And these were folks who, these are all adults. These were people who had been ill for an average of 10 years, some for as long as 30 years. These were people who were taking, when they came into the hospital at the beginning of the study, an average of 5 psychiatric medications, not at all unusual for people with chronic mental illness. And all of them had one or more markers of poor metabolic health: obesity, high blood pressure, high blood sugar, things like that. So these were people with poor metabolic health and poor mental health. And they eagerly came into the hospital to try this intervention because nothing else had helped them. And what was remarkable about what he observed was that of the 31 people, 28 were able to stay on the ketogenic diet for more than 2 weeks, which is what you need to do to start to see benefit. Every single one of them improved, to the point that 43% of them achieved clinical remission from their primary psychiatric treatment-resistant chronic mental illness. And 64% of them left the hospital on less psychiatric medication. And all of them improved metabolically as well. And you do not see results like this in conventional psychiatric care.